So now, Unit MN669, Unit 5 journal. So a never seen client in clinical rotation, diagnoses or whatnot. As you know, I haven't seen any new diagnoses. What I do want to speak about is new experience I had observed or come encounter with. So a patient came in with her mom. She was suicidal. She just said she felt worthless. She didn't see any point of living. She just felt worthless, and she has no desire to do anything that she used to enjoy doing, hanging out with her friends. Her mom stated that it was a hassle to get her in the shower, to come to the appointment today. And she was like not giving eye contact. She was speaking slow. She just appeared clinically depressed. So she was asked if she had thoughts of suicide. She stated she did. Does she have a plan, or does she just say she would be better off dead and no one would care? Or did she actually have a plan and had a thought of suicide? And she stated like, no, I want to die, and yes, I have a plan. So a question was asked, well, can you, this is a verbal agreement, and a lot of people, I've heard a lot of psychiatrists and nurse practitioners, medical professionals stay away from the verbal contract. But so she was asked the verbal contract questions. Well, do you promise that you won't try to hurt yourself without getting to the office first, or calling 911, or speaking to your parents? And she could not verbally make that agreement. So at that time, she was informed that, well, being that you cannot make that agreement, it is not appropriate for your safety to let you go. So we feel like you should go to a hospital, somewhere where you can get help. So the patient denied, said no, she did not want to go. The mom kind of agreed with her, like, well, I want her to go, but if she does not want to go, then it's nothing I can do. And so we stepped out the room, and my preceptor stated that we had to call the police. And but when he stepped out, he stated, well, we'll give you guys some time to think about it. So the mom or the daughter did not know that we were actually calling for help. So employees had to stand at each exit door, because it has been situations where a patient would try to run out the building once they seen that authorities was there to take them to get help. So 911 was called, and the situation was explained, and they came, and they took her to the hospital. There was no altercation, no resistance. She was a little disappointed, but she got on a stretcher and she just went. That was my first time seeing that happen. Usually with the verbal contracts, the patient will state that they promise they won't hurt themselves without talking to their mom or calling the office or getting some type of help. in this situation, in this particular situation, she did not. She said no. And I'm kind of glad she was honest, because that was a life saved. So when I reflect, I just think that and realize that, sometimes you have to do what's best for the patient, especially if the patient is not in the right mental state. And the parents sometimes feel a little guilt and all types of emotions where they don't want to disappoint the child, and you have to be professional enough to make that decision. And that is a way to build a good rapport with your patient also, because I'm sure that once the patient is in their right mind, they will call or come and see the doctor and thank them for that, because I don't think that a lot of people really want to go ahead with killing themselves. Statistics shows that a lot of people who attempt to commit suicide, when they fail and they come up out of it, they always say that they don't know, like, I'm the last person that would try to kill myself, and I did not know that it was going to happen. It just happened. I just, out of the blue, just did it. And a lot of them are grateful that they were saved or whatnot. But that's it, and thank you so much.